Hi, how you doing? My name is Adam Klingsheim, and I'd like to welcome you to today's presentation. Today, I'm very excited to introduce you to Dr. Terrance Govender, who is the Vice President of Medical Affairs at ClinIntel. ClinIntel has been gaining a lot of visibility lately, and if you haven't heard about him, this interview with Dr. Govender will help you learn more about ClinIntel and what is so unique about what they do. Let me introduce you to Dr. Govender. Terrance, are you with us?
Hey Adam, yeah, I'm right here. Go for it.
All right, Terrance, we have a few questions for you. Let's jump right in. Our first question is going to be, how would you summarize what ClinIntel is and what it does?
Well, Adam, ClinIntel's mission can be simply put as we bring true disruptive innovation to the severity reporting space in healthcare. Essentially, we have gone an inch wide and a mile deep on one particular topic, which is severity reporting. And that's allowed us to introduce reliable expected levels of performance for acute care organizations based on their unique patient mix. We've completely removed the industry's reliance on benchmarking by doing that. And our analytical platform gives hospitals and acute care hospitals and physicians and service lines insight as to what are the opportunities that they can capitalize on to improve and optimize severity reporting of their patient populations. So we are not a consulting firm. We have an analytical platform, which is our core product, where we are able to analyze data on a monthly basis on behalf of our clients. Some of our clients take that insight and leverage it internally, but we do have a sister product as well. That is a physician training application, and that training application is also unique because it's driven by the data that results from the analysis.
Okay, great. And what about ClinIntel is considered disruptive innovation?
Well, Adam, that's actually very interesting because if you look at the word or listen in the industry and market, you hear buzzwords. Innovation tends to be one of them, just as disruptive innovation. And so let me take a step back. In this severity reporting space, for the longest time, I think it's fallen under the umbrella of CDI, clinical documentation integrity or improvement. And there are some giants in this space, technology giants, but I think that the way they define innovation is really adding more bells and whistles onto pre-existing technologies, as opposed to focusing on true disruptive innovation. And what we've seen is that the industry, they're making a product or they're enhancing current technologies, making them more costly as well. But there's a subsector of the industry that really just wants some value that is not being provided. Perhaps they're not using all these bells and whistles anyway. So they want a cheaper product. They want something that does it better. They want something that's more effective. And in my opinion, that's why ClinIntel is disrupting the industry, is because we do something better, we do something faster, and we do something cheaper. And we do all of it without using the traditional model, which is looking at a single chart. We do all our analyses through the analysis of claims level data alone. So that's why one of the main reasons why I'd call us disruptive. Um, and that is my opinion, of course, but I have a good sense of what's going on in the industry.
Okay, great, Dr. Govender. And what would the unique value proposition of ClinIntel be to an acute care hospital?
Well, there are many value propositions that ClinIntel has. Being just inherently, we have a culture that's very energetic. We're constantly innovating, and we're constantly looking to push the boundaries and see where can we present or add more value to the industry. But at its core, I think that one of the big ones, as I mentioned already, is our value proposition is that we've removed the industry's reliance on benchmarking as a methodology where organizations were using it to identify or assess performance and then identify opportunities to improve. So we've completely removed that through our advanced algorithms. In addition to that, we are able to give you provider level data, something that the industry never had before. And if they did, it was benchmarking data. So now we're introducing provider level data. We have a very advanced patented attribution methodology that we use for providers. And I think the other one is, for the first time, the industry actually has true actionable data in the severity reporting space. It's not about CCs, MCCs, or CMI, which are all very, very misleading. We've now introduced clinical condition performance for your unique patient population. So I think those are just a handful of the unique value propositions of ClinIntel.
Okay, excellent. And Dr. Govender, who would be the ideal client or customer for ClinIntel?
Well, ClinIntel works with acute care hospitals only, and the only limitation with our model is that if you're a very small organization like a critical access hospital, then we run into an issue where our statistical analyses don't have enough sample size to give you good predictions or good analyses as an outcome. So any acute care hospital, but as a subset of that group of acute care hospitals, the ideal client or hospital or health system would be someone who actually has a vision as to where the severity reporting industry or space is going. They've encountered many, many challenges with the traditional models, with the traditional metrics. They're ready to engage physicians. They're ready to sort of take their programs to the next level. They're ready to make their program with their severity reporting effort more holistic as opposed to confined just to the borders of the CDI program. So I mentioned that, Adam, because funny enough, that's not everybody. Not everybody across the industry is ready for that yet. And that's okay. There's nothing wrong with that because I think that many organizations are at different levels of severity reporting stages. And I also think that many organizations have different types of leaders with or lacking a vision. And so the ideal client would be somebody that's ready to have an open mind and to sort of break the mold to get better results more efficiently. So acute care hospitals with a vision as to how they can take their programs to the next level.
Dr. Govender, that was great. Thank you for your time today. We want to thank you for providing a roadmap for hospital financial management to improve their hospital CDI severity reporting accuracy. In addition to today's discussion, Dr. Govender is available by contacting Robin Furlong, who is one of his scheduling coordinators. Dr. Govender is available for a personalized discussion of the CDI concerns of your facility. If you would like to receive an invitation to Dr. Govender's monthly webinars that focus on CDI problem solving and solutions, please contact Robin Furlong. Her contact information is listed on the screen now. My name is Adam Klingsheim. Thank you for joining us, and I'm looking forward to our next discussion.